Well, I think talking about the challenges with laboratory testing is really interesting. I've been doing this work with chronic fatigue syndrome and chronic fatigue for the last decade, and then long COVID the last couple of years. And I used to do a lot of testing, blood testing, urine testing, to look at all the toxins and to look at all of the deficiencies. And really, what I found is that 90% of these can be determined by symptoms. And you can't really get to chronic fatigue syndrome and long COVID if you don't have the toxic five. And so I don't even test for heavy metals, chemicals, molds, and infections anymore. I treat them all because at the end of the 12 months, I don't want to have missed anything because I've done that before. You know,
Mhm.
I've, I would test for everything and certain things wouldn't show up and I would say, great, we don't have to deal with this thing or the other thing. And then they're not better in 12 months. And what I found is that when I started treating everything, that people got better, you know? So it's kind of like the testing is imperfect for a number of reasons. If we're looking at the immune system's reaction to an infection to determine if an infection is there, it counts on the immune system being intact and functional. But when you have the toxic five, the immune system is not intact or functional. So consequently, you're asking a dysfunctional immune system to give you an accurate test.